individuals identify early signs of mental health challenges and seek timely support for their well-being? Doctor?
Yeah. So mental health is a broad terminology wherein disorders as well as not some amount of normal mental health issues or problems can also coexist. So if I say about disorders which makes an individual dysfunctional to a larger extent, then we should talk about set of symptoms which are there, which could be identified by the person themselves sometimes, and at times by their family members to notify that they are having some other sort of problem initiation. So illnesses like depression will usually begin with problems in their sleep pattern or problems in their eating habits. And family members can usually identify an altered behavior, a change in behavior of persons, and those are the usual symptoms which one can identify in person with mood disorders. Say with person with psychosis or schizophrenias, usually the alteration happens not just in sleep patterns but also in prominently in behavior, that might act awkwardly or posit some awkward sentences to the family members, which is not you like their usual self, which the family members might have observed from a long period of time. So those are the usual things which family members do notice, changes in their mood, sleep patterns or behaviors, which can help the professional to intervene early in such cases to promote an effective kind of a treatment and a recovery phase for those individuals.
Support to empower. World Mental Health Day Mega Workshop.